Nancy?
I do, Dr. Gordon. Several patients always ask me, what is the best type of filler for your lips? There's several different kinds out there, the Juvederm, the Restylane, those kind of things. What do you use to determine for the lips?
That's a good question. Juvederm and Restylane was probably the first and the most popular filler that came along. That was a synthetic filler, I should say. And let me just give us some background on this whole deal. When it comes to lip augmentation, for many years, a variety of implants were used to augment the lip. And these implants that were initially utilized were silicone implants. And because silicone is a plastic that, even though it can be very soft, and silicone implants are very soft because they're gel-like, the silicone implants that were used as lip implants, and even though they were thin, had a tendency to be exposed because they never were adequately incorporated into the tissue of the lip, and consequently with motion and slight movements, these and the fact that these implants didn't remodel and they didn't absorb to any degree at all, they would work their way to the surface and eventually become exposed or infected, and they would have to be removed. Silicone implants. Then we had an experience or a period of time where Gore-Tex was utilized as an implant material, and Gore-Tex is a Teflon material, and it was softer, and it had a textured surface, and a surface that we thought would be more readily incorporated in that the tissues of the lip, the muscle and such would tend to grow into, and the Gore-Tex or Teflon polytetrafluoride is what the name is, implant would become incorporated that way. But even the Teflon or the Gore-Tex implant also has gotten into a lot of problems. I would say 50% of the Gore-Tex implants that I would put into the lips for augmentation purposes would eventually be exposed or would move or would become a problem of some sort. So that was kind of out. And then I think it was shortly thereafter that the surgical community sort of came to the conclusion that an implant probably was not the best way to try to augment in the lip. And so we started returning to the thinking that a tissue of some sort, you want a bigger lip, then make the lip bigger with what's in the lip normally. So that's where fat was initially experimented with to augment a lip. Now, what would typically happen with fat grafting into the lip is that the lip would be big and duckbill-like and so forth, and it truly would be something that would not be acceptable to the patient at first because the lip would be so large, and then most of the fat would get reabsorbed. And I think that has a lot to do with the circulation of the lip tissue, with the constant movement of the lip and that sort of thing, that made fat not the most ideal material to use to augment the lip. So, and it was after that that materials like hyaluronic acid, which hyaluronic acid, Juvederm, Restylane, became popular, and that to this day appears to be perhaps the best material to use to augment a lip. And it's not permanent, which is a good thing. There are some materials that are more permanent that incorporate collagen was used for a while for lip augmentation, and that had its problems, like it would clump up, or if it wasn't human collagen, we were using collagen that was derived from cows for a while, and the bovine means beef or cow or whatever, that collagen, could cause some pretty severe allergic reactions as well. So that really wasn't the ideal thing either. what makes this hyaluronic acid, the Juvederm, the Restylane, that sort of thing, such an ideal in today's thinking material for lip augmentation is that it's made out of a substance that's virtually found in every living thing. Hyaluronic acid is the key component of what's called ground substance, and ground substance is basically the jelly that makes up most of the protoplasm, if you will, of all living things, whether it's a plant, an animal, or an insect. And so consequently, to use this hyaluronic acid is a great asset, because it does attract some water. So it does inflate just a little bit after it's been injected, and it lasts for a long time. It lasts, you can expect the hyaluronic acids to last for about 18 months, 2 years. And so right now, the facial filler community, and I say that because there's a lot of different specialties that would do this, we're basically just tweaking and making small improvements, small modifications in the exact type of hyaluronic acid, where we're putting it, whether or not there's a local mixed in with the hyaluronic acid, so there's not a lot of pain, and things like that would make one product perhaps a little bit more competitive or more desirable than another. So those are the kinds of things that we're doing now. So the short answer to your question is injectables like hyaluronic acid have become very popular for lip augmentation. Now, me personally, when I do a lip augmentation, what I'm more often than not doing is, I'm injecting this HA, we call it HA, because that can be Juvederm or Restylane or several other materials, into the actual border between the white part and the pink part of the lip, into that vermilion border. I inject it along there, and it acts as a neutral color lip liner, if you will, or lip enhancer. And it really, what that does is it really accentuates the outline of the lip, and it does add a little bit of volume, and it really does make the lip stand out in relief and makes the lip a much more attractive lip without really doing a gross augmentation or volume increase in the lip, which can sometimes make the lip look a little distorted. And then the other thing that I do with this HA is I'll also inject it vertically into that little column that goes straight up from the peak of the lip on either side of the middle part of the lip, and give that filtral column a little extra boost. And so that makes the lip look nice. For women who have like a fine, wrinkly sort of appearance to the upper lip, we also can use materials in the substance of the lip itself to give it a little bit more fullness. There's a tubercle or a central portion of the lip in the upper lip that got a little bit of a ball appearance that we can sometimes like to enhance with it as well. Generally speaking, I try to discourage patients from having their upper lip enlarged to the point where it's as big or bigger than their lower lip, because then you really kind of lose a normal aesthetic proportion. There are some actresses who have opted to have their lips augmented to the point where they really look a little odd, a little strange to me. And one should realize that it's quite normal for the lower lip to be in a ratio of 1 to 1.618 larger vertically and fuller than the upper lip. So that divine proportion, or that natural proportion between lip height, is something that I try to preserve.